Hey, it's Bernard Nomberg with the Nomberg Law Firm here in Birmingham, and I've got my good friend Dr. James Worthen. Dr. Worthen, thank you for being with us for a few minutes.
Absolutely, thank you.
Dr. Worthen is an orthopedic surgeon here in town in Birmingham with many years of experience. And at our firm, we handle lots and lots of cases from work comp and from a car accident type cases for truck drivers, whether it's 18-wheelers or cement trucks or whatever it may be, folks with a CDL or not. They all have similar type of injuries, and I know Dr. Worthen treats those types of injuries. If you would, Doctor, tell us what type of the most common types of non-traumatic injuries, and then we'll go to traumatic type injuries that you've diagnosed and treated over the years with truckers.
Yeah, the non-traumatic injuries seem to be more positional type injuries. The ergonomics of being a truck driver and being in one position for a long period of time. The armrests are important because a lot of times people come in with things, we call them, the tennis elbow, golfer's elbow, but the orthopedic name for it would be epicondylitis. And you see that because they rest their arms in a particular manner and really inflame that area where the tendons attach on the elbow. That's one example. Another example is the position of their hands on the wheel, and sometimes carpal tunnel occurs because of a repetitive position of their wrists. Other things are a lot of these trucks that these people are driving are very high up, and so they use their arms to pull themselves up into the cab, and you'll see some repetitive type of injuries to the shoulder area, which can be rotator cuff kind of issues, tendonitis that may develop, and even neck issues of one position of driving and aggravation of some of the musculature around the neck.
Okay, and those are those types of injuries are the non-traumatic type of injuries.
Correct.
And then what type of trauma based injuries do you see?
Well, trauma, the more severe would be a true accident of the truck itself, but a lot of the traumatic events we see are more to do with, I mentioned getting up into the cab. Well, you can have one episode where you get up and you feel an actual injury to the shoulder, which may be a rotator cuff tear. Other things have to do with what is the truck driver actually hauling? When they stop, do they have to unload? You'll see traumatic events from maybe a fall from actually a significant height off the trailer when they're trying to cinch things down. Other things where they're actually undoing some of the apparatus that may the trailer hitch, that kind of thing. You'll see some hand injuries that are more acute in that environment.
And in addition to hand injuries, shoulder injuries, I'm assuming with some of these traumas, you see back injuries, leg injuries, lower extremities.
Absolutely.
Probably the whole gamut.
The whole gamut, yeah.
And with all of these injuries, whether it was traumatic based or repetitive based, they can go either the conservative route, which is, tell me if I'm wrong here, physical therapy or medicine or rest or injections. That would be the conservative route. And then from a surgery standpoint, depending on the type of injury, that could really be determined on what kind of rehab and they may be out of work for a period of time.
Correct.
What are some things that you would recommend, just based on your experience in dealing with these injuries, that truck drivers, folks who are sitting so many hours a day in a week and a year behind the wheel, what are some things that they can do to help themselves out that before they unfortunately got involved in an accident or had some type of injury, that they can do to help themselves, so if they have to go through all of this, it would cut down on their time of being away from work and their recovery time?
I think a lot of things can start with health, working on personal health. I think that's it's very difficult to when you're in a job that involves sitting all day and it wears on you and you're fatigued at the end of your shift or the end of the trip. It's very difficult to incorporate a physical fitness part to your day, but it is so important because if you do get one of these injuries, the healthier you are, the faster you'll recover and the easier it will be to get back to work. So that's one thing. Another thing is working on different techniques while you're at work, whether it's The seat that you're sitting in, you need to make sure that it's comfortable for your back, it's the proper fit. The armrest, as I talked about, the elbows, that's important. Also, if you do have to unload or load or hook up with the trailer, you need to work on lifting technique. Be careful of the back. And also getting on and off the rig is important as far as how you hold your shoulder. These are things that are important, but oftentimes we think about them too late.
So having proper technique, having a lifestyle that allows you to be in better physical condition, having a good attitude about things once you do get injured, and the one thing that we can't change is our age.
Yes.
Would you agree that the younger you are, the more likely you're going to recover a little bit more quickly?
Correct.
Well, thank you, Dr. Worthen. I sure appreciate you sharing your expertise here for a few minutes. If you guys are injured in this type of an accident or have these types of injuries, just give us a call. We'll be glad to talk with you. We might even get you over to Dr. Worthen to see if he can also help you out. We can be reached at 205-930-6900, NombergLaw.com.